Hi, welcome. Today we are going to talk about person-centered therapy, also known as Rogerian therapy. And so this is often where we see a shift. This really revolutionized the therapeutic landscape, where we shift from a therapist-focused, therapist-directed approach to a client-centered approach. This therapy was developed by Carl Rogers in the mid-20th century. And Rogers really starts to really focus on therapy that's client-directed or client-led, client-centered. So it's really about the person and what their specific needs are, outside of our therapeutic bright ideas about how we think the treatment should be, how we should execute, what interventions we should do. It's actually related to a real quality of deep listening and openness, and knowing that the actual client is the master of the session. They are the ones who know best about what they need to grow, to thrive, to live a meaningful and good life, and that our job as a therapist is to come back and to reorient to them again and again and again as the expert of their experience. So this is really central to this theory is this belief that people have the capacity to grow, to change, to actually self-actualize. And part of that change or that growth in this approach is really utilizing the therapeutic relationship itself. So the relationship between you as the therapist and the client. And that relationship is actually one of the most powerful and important and healing tools that is available, that can be available, is the relationship itself, how the client is connecting to you. This is the primary agent of change. And so we really start to place trust in the client and their own solutions, that they know the solution, that they are the agent again. And we, support them by creating a supportive environment. So what are the core principles? One of the core principles here is empathy. So this foundational pillar of our ability to really understand our clients' feelings and their experiences in a deep and nuanced way. Carl Rogers really emphasizes that empathy is a special way of coming to know another and ourselves as a therapist, kind of both attunement and a resonance. We have to really let go of our own worldview and enter the client's worldview. So we have to notice and let go of our own biases, our own assumptions, our own ideas about what's right and wrong and what should be, and really enter and submerge ourselves into our client's world, the person ahead of us. This really supports people in feeling understood and can really create an environment of both safety and trust that can really help people do deeper levels and capacities for inner exploration. Another one of the principles of Rogerian therapy is really this quality of unconditional positive regard. When you see Rogers' work, you can kind of see him exude this unconditional positive regard. This he defines as accepting and caring for the client without judgment. So it's really a non-judgmental acceptance that really creates an atmosphere where a client feels safe to freely express and explore their true selves without fear of rejection or fear of disapproval. Rogers believed that lots of issues arise with conditional regard. So when people feel valued only under specific conditions. I will value you if you are a good boy. I will value you if you fill in the blank. And so this is actually the space that a therapist creates where the client can really feel valued, accepted, non-judged, in this non-judgmental environment, no matter what's coming up for them, no matter how big and how challenging or how difficult that the therapist continues to show compassion and warmth and care and interest, curiosity, understanding, really in this foundation of non-judgment. He also explores congruence or authenticity, and this really can be defined as the therapist's genuineness, the transparency of the therapist, the capacity and the openness of the therapist to be truly who they are within the context of the therapeutic relationship. Rogers once said, "The curious paradox is that when I accept myself just as I am, then I can change." And so it's really this modeling that starts to happen. This is who I am. This is who we are. This congruence helps clients also become more authentic and more congruent and really work towards accepting themselves. So part of our practice as therapists is learning to deepen into our own ways of being and trust ourselves, trust our, we could say therapeutic intuition, but trust that what we are feeling and knowing has relevance and importance to the therapeutic relationship. And so when we are congruent, we express our feelings clearly, appropriately, and we really avoid an artificial stance, which could create distance between us and the client. And so it's really about being honest, being true to who you are. So Rogers really believed that the therapeutic relationship itself is the vehicle for change. And we are really emphasizing the relationship between client and therapist as the primary source for change. When we can embody our empathy, our positive regard, and our congruence, the client really feels safe to explore deep emotions and experiences within themselves, which really can lead to personal growth. He summarized the essence of person-centered therapy as when the other person is hurting, confused, troubled, anxious, alienated, terrified, or when he or she or they are doubtful of self-worth, uncertain as to identity, then understanding is called for. The gentle and sensitive companionship of an empathetic stance provides illumination and healing. Another central tenet of person-centered theory is this, what he calls the actualizing tendency. And inherent in this actualizing tendency is this inborn drive that we have towards both growth and fulfillment. And so he really believes that all individuals possess this drive towards fulfillment, towards growth. He states the organism has one basic tendency and striving to actualize, maintain, and enhance the experiencing organism. He really felt as though people are naturally oriented towards both health and well-being, but that they become disconnected from their true potential due to pressures that they put on themselves, that society puts on themselves, due to conditional relationships, and to internalized judgments. We could also say internalized oppression. And so the task of therapy in many ways is kind of getting below some of those layers to deeply begin to listen to what inherently wants to emerge, what wants to come through, what wants to actualize, what wants to be healed, to be known, and what gets masked over by some of these societal pressures, these internalized beliefs. How do we come back to this deep knowing and as an orientation to continue to come back to what's happening in the here and now, what's happening in our relationship, that we're two humans relating in a room. There's no God's eye view per se. There's no one person, the therapist, for example, that knows all, sees all, that we're in this collaboration together. And this collaboration is about discovery, it's about growth, it's about relationship, and learning how to relate and heal, and really centering the client as the expert, the client as the one who knows. And so removing this kind of top-down way in which therapy was done previously. in the more analytic sense, where the analyst controls the treatment. The analyst directs the treatment. And so rather than being analyst directed, Rogers comes in and throws the whole thing on his head and says, no, it's not about us being experts on someone else's reality. It's about really tuning in and knowing that that expertise can only exist within the person who's having the experience. So I hope you enjoyed this little overview about person-centered work, and I hope it benefits your future work with clients. Thanks so much. See you soon.